All right, you guys, RalphHavens here, physical therapist in Bellingham, Washington. And I'm going to show you a technique, a series of techniques for your body to help you move better, walk better, run better. I use it for myself before I do races or before I do long runs the night before. I use it with my little boy, little track star boy, who we use it the night before he does races, which helps him feel lighter and bouncier and just better, stronger. And so to do it, I'm going to explain a little bit about it first. And a very key principle of it is to use very, very light touch. And I'm telling you this because if you use this super light touch, you're accessing a system in the body, a nervous system in the body that activates very deep layers of healing in the spinal cord, even in the deep brain levels of the brain. And if you push a little too hard, and I mean very little too hard, you bypass that system and it really won't do the magic. But if you use a very light pressure, you can see some big changes. So what I invite you to do is pause the video, walk around, and see how you feel. Even if you're a runner and you want to just run for 50 meters and back, test that out a little bit, and then come back and restart the video, and then we'll do this process, and you can retest it after you're done. All right. So we're going to use this light touch. The touch pressure is so light that if you were touching a butterfly, you wouldn't hurt the butterfly. So you got to imagine that's very, very light. We're talking 1 gram of push. It's very, very light. If you touched any less, you wouldn't be touching. All right. So there's these points. You could call them reflex points or magic points. And there's points in the body that activate this deep level of healing. And just to let you know, I found it from a colleague, friend of mine, teacher of Integrative Manual Therapy, Dr. Tom G. Mateo. He found it from Ed Glazier, a podiatrist. And I believe it came from an old chiropractic technique called Logan Basic. So here goes. What you can do is take one hand, and one of the points is right here on the inner knee. And the other point is just the front of the knee, below the kneecap. And what you do is you just lightly touch with that 1 gram of touch that inner knee. For those of you that have some palpation skills, manual therapists, you might notice that the fingers that touch this front of the knee drift up a little, and the fingers that touch the side of the knee drift forward. If you don't feel it, that's okay. Now, just doing this alone will have a big shift on your body. If you did this for 10, 50 seconds and then walked around again, that knee will feel looser and lighter and function better because you're activating this deep reflex that goes to the spinal cord and then all the way up to the brain. Now we're going to combine this with a technique for the lower leg. So the side of the leg has that fibula bone all the way down to that ankle bone, the fibula. And what you can do is with this hand on the knee, super, super light, the other fingers very, very lightly, think of here's the bone, behind the bone I'm going to touch very lightly. And I mean like a gram of pressure. It's not even pressure, it's a gram of light, light, light touch. And you hold it for 5 to 10 to 50 seconds. And then you can go down and hold it just for 5 or 10 or 50 seconds. And you just follow along with me as we do this. And so I'm on the back side of that fibula bone. I'm going to go down. I'm going to go down. Again, the one on the knee is super, super light. I'm going to go down, and I'm going to go underneath that bone. And I'm going to go up on the front side of it. I can't emphasize enough how the pressure is so, so light. Both hands. When you get to the top, you'll feel the very top of that little bone, and you can go on the top of that bone. There's also right at the ankle crease there's a joint, talotibial joint. You can just touch that. And then let's do the other side. Touch that inner knee. Again, just holding that alone does big magic. 10 to 50 seconds or more. The other fingers go on the back of that fibula bone. I think maybe the hardest part of this is keeping the touch so light. And for me, it helps to know, oh, we're doing these, there's these reflex points just underneath the skin. And if we press too hard, we're bypassing this system. So I'm underneath that bone. I'm going to come up the front. The very top. And then the front of the ankle crease, super light. And if you like, you can pause the recording and walk around and see how that feels, and then come on back. Okay, the next one is these bumps right here. We're just going to go up the body. So the bumps on the front are called your ASIS. It's the front of your pelvic bone. And what you can do is just touch them. So just lightly touch them both. Just that 1 gram of pressure. It does big things. Seems hard to believe, I know. The proof will be in how you walk and how you move and how you run afterwards. Now, what you can combine with this one, there's your pubic bone, and then the front iliac bone, and that line in between is where you crease, and halfway between it is your hip. So you can super lightly touch that hip and super lightly touch this spot, and hold that for 10 or 50 seconds. And then you can touch here, the front of the pelvis bone, the pubic bone. There's that crease. And just halfway between, just super lightly touch. Again, just a few seconds, 5 seconds, 10 seconds, 50 seconds is great. If you have a tight hip, it's a nice place to hang out for a minute or two. Okay, the next one is this same little bump. You can switch hands, just very lightly touch the front of it. And then that pelvic bone that goes around, just be on the top of it. You can come back up and around. Let's do the other side. Touch the front of the hip bone. Touch between the pubic bone and the pelvic bone, the hip, right there. Touch. Switch hands, touch that bone, and then that pelvic bone all the way around. 5 to 10 to 50 seconds. Come back around. Okay, the next one is pretty cool. You can think about your six-pack. So you've got your six-pack, you know, the sides of your six-pack and the center. You can take the little finger side of your hands and just touch the side of your six-pack and the front of the center line, and just super lightly touch. And then you can bring the pressure with both hands a little to one side, let's say to the left side. Again, 1 gram of pressure, 5 to 50 seconds. And then go down a little bit and lightly touch, glide to the left. Then at the top, other side, slightly touch, go to the left again. Whichever side you pick, go to the same side each time. Tomorrow you can go to the other side if you want. And down. You can go underneath the rib cage. Here's the rib cage. Just touch. Touch. This helps the ligaments of the body, the connective tissue. Just touch, touch, touch. Now the next one is really cool. You touch your belly button and the very top of your breastbone. You get your soft throat, and the very first bone is called your manubrium of your breastbone. Touch the belly button and this spot, and you direct a little pressure up. 1 gram of touch. This can get you into a very deep meditative state very, very quickly. Okay, now this one is really cool. My son loves this one. Touch the top of the breastbone, the manubrium, and right where your the head bone is, the occiput, just below it, the first part of the soft spot between the head and the first bone. You're gonna take your thumb and index finger and touch about less than a centimeter away from each other, just in that spot. And just to direct a little pressure up towards to the ceiling. This one, a little touch, a little up. This also activates a lot of deep meditative states. I love doing this one for a while. And when you do it, you'll feel different when you walk, which is the most amazing thing. You can take this spot and just go down the spine. So think of a finger touching in between each of the bones in your spine. And you can go from the bottom, just kind of go to the center of your back, and just as best you can, let the finger drift in between a couple of the bones, and then go up. And then go up. See, 1 gram of touch is the key. Now this next one is an extra credit one. I thought about, should I show this one or not? It's very, very powerful. It's just that it's a kind of it's more involved to reach. So think of the bones that you sit on. You could just kind of lift up and feel for the bone that you sit on. And just to the inner edge of that bone, like a centimeter in, you can touch that spot. So you kind of touch the bone you sit on, and then move your fingers over just a hair, and then stay up off of that bone somewhat. Or you can sit back down somewhat, but direct a teeny bit of pressure on that spot that's just to the inner edge of that bone. Yeah, and then take your other 2 fingers and go just below the occiput and touch there. And if you've been doing this along with me here, you may feel a little sort of woozy or sort of light or meditative, or like there's something going on. If you're a manual therapist, you might feel some of the rhythms of the body improving. And then take the other side. So the fingers touch the bone you sit on, just a little to the end, and I mean like a centimeter, and just lightly, lightly, lightly. Let's see, there we go. Touch that, and then finger, thumb, upper part of the neck, very upper part of the neck. I kind of like to be off of the bone, and then just super lightly touch with 1 finger on that spot. It's called your sacrotuberous ligament. So there's a lot more spots, a lot more techniques for all these joints and tendons and ligaments in your body. Some that you can't really reach by yourself and would be involved for me to try to teach you, but these are some that you can use for yourself. Try them the night before a big race, before you go for a walk, like the night before you go for a big walk or hike. Just in the evening, and then the next day notice how you feel walking around. Or you could even do them right before you walk and go walk in the park or take a run. And notice what you notice what's different. And let me know, Ralph at RalphHavens.com. You can find me at RalphHavens.com. And if you're in Bellingham, Washington and need some help for hands-on manual therapy to solve the chronic running and sports injuries and autoimmune conditions, chronic pains, other chronic conditions, when doctors don't have answers, reach out to me and I can let you know what I see that's going on with you and how to help you get your health back and get your life back. I also do sessions online worldwide, and so reach out to me. I'd be happy to meet with you and let you know what I see and how we can help. All right, you guys, let's get out there and live and really live.